Hey, I'm Dr. Aaron Lewis, and I'm here with my dear friend. I mean, my one of my closest friends, Dr. George Curry. He's the former president of the International Chiropractic Association. He has an amazing chiropractic office in Windsor, Connecticut. He's an ex baseball coach, former basketball coach. In fact, he actually coached my daughter Madonna for an entire year with basketball. I mean, he's just a complete humanitarian. We went over to Dominican Republic and opened up chiropractic in that entire country. He's just an amazing man doing tremendous things. And I wanted to just take a moment just to talk with him about what's going on today, because right now we're in the middle of a crisis. It's not just a national crisis, but it's an international crisis. And one of the things that I know is that within any crisis, there's an opportunity. The actual Chinese word that means crisis is the same word that is interpreted opportunity. So in a crisis, there is always opportunity, and our bodies during this particular time needs to increase in terms of immuno health, and no one better to talk to than chiropractors about the spine and how the spine continues to help the body. And so I really wanted to hear from Dr. Curry with some advice to all of us, not just for this season, but for always. We need to always have good health. And so, Dr. Curry, what could you tell all of the people about good health?
Well, there is hope. Right now, there is a crisis, and tens of thousands of people have succumbed and have passed away. And I think that our whole society has to, it's been a wake-up call. We have to focus our attention not so much on the Covid-19, because we can isolate ourselves from it, but eventually another virus will come, and then another virus will come. In fact, every year a virus comes, and that's the whole theory behind the flu shot, is because it's a different virus every year. What this has shown us, beyond any shadow of a doubt, this crisis, is that it's the host, it's the person's health and resistance that's the primary factor. So if two people from the same house get exposed to the COVID-19 and they're in a hospital, and one recovers and the other one doesn't recover and dies, it's not the COVID virus, it's the ability of the person to fight it off. Right. And what we've learned is we've kind of been fooling ourselves to think that we're a healthy nation and that we enjoy good, robust health because we take so many pills and powders and potions and drugs to suppress our symptoms, but we're not really healthy. And so when we get exposed to something that our immune system can't handle, then we pay the price. Mm-hmm. But it was the famous French physiologist Claude Bernard in the 1800s when they were studying the germ theory of disease, and he looked at it and he said, this physiologist said, you've got the seed and you've got the soil. The seed being the germ, bacteria or virus, and the soil being the host or the body. And seeds will not take plant unless the soil is fertile. If you have a weakened immune system and a weakened body, and we know what you can do to help your immune system be at its best, and we know things that lower your immune system. So stress lowers your immune system.
Wow.
A bad diet lowers your immune system. Lack of exercise lowers your immune system. Having a bad attitude lowers your immune system. From a chiropractic standpoint, making sure the brain can send the signals through the spine out to the various organs and have a spinal column that's free from interference, that's a key. So we've been deemed as the federal government, chiropractors, as essential providers, and that's why we've been open since day one. We're open 6 days a week, serving the community, doing what we can to make sure that there's no interference with their spine and nerve system, and counseling them on what they could do to be healthy. Because we all probably eventually are going to get exposed to it. We can't live in a bubble.
Right.
That's just not how we can't survive like that. So the key is to get and boost your immunity, and that's the key. And face the fact, especially the African American community, someone say their health is ignored. They have higher rates of asthma, higher rates of diabetes, and so forth. And no one is really shed light, or they had, some people have, but it's kind of been a secret that we're not concentrating
swept
on.
under the rug.
Yeah, swept under the rug.
Yeah.
And now that this bug is coming and they're confronting it, they don't have the healthy immune system that we thought they had.
Right,
see?
exactly.
So now this is an opportunity to look at us and say, what can we do as a society to really bring forth health? So rather than study the people that are sick and dying, let's study the people that were exposed to it and survived. What do they have that we need? In fact, they're even going so far.
I love that. I love that.
They're going so far as to say, let's take the plasma of the blood of the strong ones and give it to the weak ones.
Wow.
I get that. That can work.
Yeah.
But how about taking the weak ones and getting them so that they can be healthy like the strong ones?
Yeah.
That's the focus. That's where we got to focus.
Listen, he said it just now. Let's stop focusing on those that are dying, but rather focus on why the ones that are living and thriving. That's amazing advice. Listen, go out and get adjustments. Make sure that you keep your immune system strong. We're going to all get through this together, and we're going to be on top.